As a family doctor, I can't tell you how important it is to listen to your body. I've been in practice for about 13 years or so as a family physician, and one thing that I'm always struck with is really how people know themselves. And I want you to know that you do. I can't tell you how many cases of medical conditions, issues, diagnoses were maybe prompted or encouraged or even gotten because the patient not only listened to their body, but they advocated for themselves as well. I'll never forget there was a patient. This is a patient I saw some years ago, and he came in to me with some leg swelling that had been going on for a while. He had seen a number of doctors about this, over maybe the course of a year or two. The leg swelling, the joint swelling really was not diagnosed. Nobody quite knew exactly what it was. But to the patient's credit, he was persistent. He didn't feel like this was normal for him. He didn't feel like this was right. He didn't feel like this was just nothing, which was kind of sort of what he'd been told. And I give all the credit to him about his persistence, because his persistence is what paid off, and his continuing to listen to his body is what paid off. By him continuing to bring up the issue and saying, look, I just am not sure that something is right. Can we do something else? Asking questions, being involved in his medical care, paying attention to the symptoms that he had, even jotting them down, etc. I think helped doctors really come to a diagnosis of a rheumatological condition that he ultimately ended up having. Now, not every situation will end up like that, of course, right? We hope that there is no underlying condition. We hope there's nothing wrong. But the point of this video is really to say that if there's any one thing that I've learned being a family doctor is that patients and people, you know yourself, okay? Doesn't always mean there's going to be something wrong, but it means that you should believe how you feel. Even if other people are telling you, oh, it's nothing. Oh, it's all in your head. Oh, it's nothing to worry about. If it's something that you are worried about, then it's worth pursuing or at least asking questions about. Now, the situation may not end up in a diagnosis. Once again, we hope everyone stays healthy, but the idea is that if it's something you're concerned about, something with your body that doesn't seem right, you deserve a discussion about it, and hopefully an answer if that's possible. Over the years, it's interesting. I've heard so many stories of patients who have listened to their body. When they were told that their shortness of breath was really nothing much, they continued to look into it, finding out that they had asthma or something worse, ultimately, when that was initially dismissed. Or being told that their rash or their lump or their bump is really nothing at all, only to find out that actually it was and is something. And that was found out because of the patient's persistence. Look, in this day and age, we live in such a time of uncertainty. There is so much going on in this world. Let me tell you, it is tough, right? But one thing I can tell you that is pretty definite is that you know your body. You know yourself. And it doesn't always mean that something is wrong. That's not what I'm saying. But it does mean that you should listen to your body. And you should pay attention when something doesn't feel right or when you have questions. And that you should ask to have discussions and to try to get answers when you do have these questions. That is your right. That is something you deserve. And don't ever let anyone make you think that you don't. So, as your friendly family doc, I just wanted to stop in and tell you guys, keep listening to yourselves. You're not only doing yourselves a lot of good, but in some cases you might be helping out your healthcare provider too. Don't hesitate to ask questions. That's what we're here for. We're supposed to help answer them and to help guide you. And if you don't feel like you're getting that from your healthcare provider, well, you know what? You have my permission to find another one. Guys, I'm Dr. Jen Caudle. If you've not subscribed to my channel, I invite you to do so. Please click the little bell. I do daily health videos, as you guys know, on COVID, on health, on everything under the sun. Guys, I will be back soon with more videos.